Coming. My name is Jonathan Moda. I'm Communications Officer here at the Oregon Health Authority. So this is a press briefing on the air toxics issue here in Portland. You will hear from senior leaders with OHA and DEQ. We also have folks from Multnomah County and some of our other partners. I wanted to just really quickly go over some ground rules here. So this briefing is scheduled for a half hour. It could go over, but we're trying to sort of keep it to a half hour, but we understand that you may have questions and needs for one-on-one interviews afterwards, so we'll certainly accommodate those and other follow-up interview requests. So each agency director will make a few opening remarks, followed by our data experts who will discuss the findings that are in the news release you have, and then we'll move on to questions. Ask you to hold your questions to the end and ask one question at a time so others get a chance to ask questions. And if you try to ask more than one question in a question, I'll interrupt you so another person can get a chance to ask. So with that, let's get started. Joni Hammond is the interim director of the Oregon DEQ, and Lynn Saxton is the director of the Oregon Health Authority, and they will start us off with a few opening remarks.
Thank you. Good morning. I'm Joni Hammond with DEQ. Thank you all for coming today. In addition to direct communication from DEQ to the public, we need partners in the media. We need your help to provide clarity, correct information, and also the context so that the families that are affected aren't unusually alarmed. You'll notice I'm glancing down at my notes a few times because I want to make sure that I make all my points. I understand the public's frustration in our process and our communication. And we are going to work on and are working on getting better at that. Part of that commitment is a new website that will be placing the data and information that we're providing today on that website. Obviously, that's not the only form of communication we're going to have. We will also have other forms, but I think the website is a good addition. Today, in partnership with Oregon Health Authority, we have a first round of soils data surrounding bullseye glass. Our agency experts will walk through in more detail what the results show, both our DEQ expert and our health expert. In addition to today's results, we'll also be providing you air results next week. We've done additional sampling in North Portland. Those results will also be out next week. Before Oregon Health Authority Director Lynn Saxton provides her opening comments, I also wanted to let you know, if you haven't heard, that we are beginning permanent rulemaking this month. And that will be to move our air quality permitting system to a health-based system that incorporates health data into the regulatory authority that we provide today. And that is similar to what Washington and California have.
Good morning. I'm Lynn Saxton, Director of the Oregon Health Authority, and thank you, Joni. It's a pleasure to be here with you today. And thank you for joining us, members of the media, and for keeping the public informed about air quality issues in Portland. Today we're here to report results from soil testing near the Bullseye Glass facility in southeast Portland. In addition, we're going to share findings from a study of cancer rates in North Portland, as well as data from labs who have been reporting results of cadmium testing to the Oregon Health Authority. Since January 21st, Oregon Health Authority has been working to provide Oregonians with the information they need to make good health decisions. That's our core mission. That's what we do every day. When the public learned heavy metals were being emitted into the air over neighborhoods in southeast and north Portland, we began to work closely with our epidemiologists, our toxicologists, and our scientists to be sure that everyone had information as quickly as scientifically possible. We understand that people have been worried, upset, and confused. I live in Southeast Portland and grew up in North Portland, and I understand the concerns of those communities. People want to know, what does this mean for me and for my family? And what are state and local agencies doing to protect the public's health? First, we've been answering the public's questions. Since we learned heavy metals were in the air, one necessary and important step we've taken is to collect data to give people clear answers about the risks these metals pose to their health. Today we have some of those answers, and we will continue to do that analysis, collect data, and provide answers. Secondly, we've been assessing the impact on health. As you'll hear from our experts, the news is encouraging. We're not seeing evidence of health problems caused by metal emissions. We've also been putting together the pieces of this complex puzzle. The data we'll discuss today are just a few of the pieces of that puzzle. Soil data tells us about the extent of long-term exposures. Cancer studies tell us if there have been increased rates of cancer linked to heavy metal exposure in surrounding neighborhoods. Urine tests will tell us if there are high rates of people with high levels of cadmium in their bodies. All these data are important, but they're not the whole picture. Next week, we'll report on air data collected after the companies stopped using cadmium, arsenic, and chromium in their production. Those samples will tell us if levels of metals in the air are declining and what air quality data means for people's health. We appreciate the community's patience. Collecting these data is a process. In Oregon, we are committed to using data to inform decisions. It's the cornerstone of our health system across the state. We know people are eager to see the results. We appreciate the community's patience as DEQ and OHA scientists have been doing their work together to gather reliable data and understand what we are learning. We will continue to test and analyze environmental data. While the data you will hear about today is reassuring to us, our work is not done. We will continue to gather and report data going forward. Finally, we are very excited about the opportunity to advance best practice policy changes. The data we're gathering through this process will inform changes in public policy and producing rulemaking that is state-of-the-art. We're committed to working with DEQ. We've been doing it from the beginning, and we will continue that intense work at every level of our staffs and our operations. And we are first and foremost committed to the community to ensure health-based risk assessments are part of the permitting process for air emissions from factories that use heavy metals in their manufacturing. Now let me turn it over to our experts who can tell you about the studies we've conducted and what we've found.
Thank you, Director Saxton and Director Hammond. I too am going to read a bit from notes here. But
Can you say your name, please?
I will. My name is Keith Johnson. I'm a manager at DEQ's Northwest Region offices. I work primarily in the Contaminated Property Cleanup Department and have recently been temporarily reassigned to assist with Portland air toxics work. I'd like to provide you with information related to DEQ's soil sampling efforts, which we undertook in mid-February in response to the emissions. The goal of the soil sampling adjacent to the Bullseye facility was to determine if historic and ongoing emissions have impacted soils in areas surrounding the facility. Because soil can act as an accumulator of sorts over time of impacts, and given the length of operation of the facility to date, soil impacts should be fairly conclusive as to whether impacts are occurring from these emissions or not to soils. DEQ's soil sampling was done consistent with our approved sampling analysis plan, and this plan follows all state and federal quality assurance guidelines for sampling activities. I do want to appreciate or acknowledge everybody's patience with getting the sampling done and the results out, but as we do this work, having these approved plans and authorizations in place to do the sampling just takes some time. The plan itself was designed to focus sampling in areas of public access and or people of higher risk and where they might live or be in this area, including children, which are a very sensitive receptor for toxics. Sampling was also performed at a variety of distances from the facility, which allows for an evaluation of how impacts might change with increasing distance from the facility. And if you look on the monitors here, we have a couple of slides we'll be showing in conjunction with my presentation. This first slide here shows the soil sampling locations at and around the facility. As you can see, DEQ sampled in 3 areas around the Bullseye facility. The CCLC Daycare Center, where we took 15 samples, certain areas of the Fred Meyer employee parking lot, where we took 22 samples, and finally across the entirety of Powell Park, where we took 30 samples. Samples were taken of soils at the surface or slightly under the grass or sod. In Powell Park, some samples were also taken of the mulch in the children's play area, as we felt this would be an appropriate place to see if there's exposure. All samples were tested for arsenic, cadmium, total chromium, and chromium-6, lead, cobalt, and other metals that are believed to be associated with stained glass manufacturing at the Bullseye facility. Note that most metals, such as cadmium and arsenic, occur naturally in the earth, which means that if you sample for these things, regardless of where you are, you're going to detect some of these metals. We call this background or background concentrations of metals. It's just they occur naturally in the earth. So it's important to understand that there are background values for these. To interpret the results, DEQ calculated averages for each contaminant over each of the 3 areas tested. I put up a couple of few pictures of some of the sampling that we did. They were, again, grab samples with DEQ staff. Moving to arsenic results, as you can see on the screen, arsenic levels were generally consistent with background in most samples at Powell Park and the Fred Meyer locations. Estimates of average concentrations at these 2 locations are below DEQ's estimate of background for the Portland Basin. At the CCLC Daycare, concentrations exceeded both estimates of background and conservative soil screening levels. And these screening levels, which my colleague here will explain a little bit more, are fairly conservative values to indicate if there might be a potential risk. Let's see. For chromium-6, or what we call hexavalent chromium, results were variable, with most results below the limit of detection of the testing. At Powell Park, average concentrations were very low. At Fred Meyer, there were really no appreciable detections of chromium-6. The CCLC Daycare location had the most detections, with average concentrations exceeding DEQ's screening level, but less than the ATSDR, which is a federal or CDC screening level. Again, my colleague David here will explain a little bit more about what that means. Average concentrations of lead and cadmium at all locations were at or below all screening levels values, although some specific sample locations showed modest elevations over background. And no contamination was detected in the mulch samples in the play structures at Powell Park. So based upon these results, DEQ concludes that ongoing emissions from the Bullseye facility are not resulting in harmful impacts to soils around the facility. To address continued concerns regarding soil quality, DEQ will, however, be offering to review individual sampling results from homeowners or organizations in and around these facilities. And a link for this service will be provided on our SHARE website. And with that, I'd like to turn it over to my colleague, David.
Yeah, so I'm David Farrer. I'm a public health toxicologist with the Oregon Health Authority. We pretty routinely work with the Department of Environmental Quality on cleanup sites, and we have a set process for how we review data that they provide us from environmental sampling. The first step in this process is to compare the average concentrations of the metals that they measure against screening levels. And as Keith said, I'll show you. Oops. There we go. So the three horizontal lines that you see on this chart represent different types of screening levels. The backgrounds, the Portland Basin, the line labeled as Portland Basin, is the background concentration that Keith was talking about. That sort of represents the level of these metals that one would expect to find in soils anywhere in the Portland area. The line labeled as DEQ cleanup guideline is the conservative health-based screening level that DEQ uses as a guideline when they're making decisions about cleanup at hazardous waste sites. And the CDC guideline is a screening level developed by the Centers for Disease Control, CDC, and that's a screening level used to as a point at which to decide whether or not additional analysis is needed for health effects. So we wanted to show different kinds of screening levels to provide as much context as we could for the data that DEQ collected. Our process is that when a contaminant is measured below a screening level, we feel confident that the concentrations of those metals are too low to harm health of anyone. So we don't do any further analysis when a metal is measured below a screening level. If a metal, and that was the case for most of the metals that were measured, that includes cadmium and lead, and most of the other metals. When a metal is measured above a screening level, that does not necessarily mean that there are going to be health effects or that there is a risk, but that does trigger an additional level of analysis, a more in-depth analysis. And the meat of that in-depth analysis is really to take those average measured concentrations and make some assumptions about how people come into contact with the soil, how much they swallow, and what kinds of people are exposed, whether they're children or adults, and to estimate a dose to those people. And then we are able to compare those doses against doses that we are confident are protective of health, that people can be exposed to without harm. In the case of cadmium, you can see here the average concentrations of cadmium were in many cases above the Portland Basin background, above what you would expect to find in the Portland area, but none of them were above health-based screening numbers. So we did not do additional analysis on cadmium because it's below those health-based screening levels. So we feel confident that concentrations are too low to harm anyone's health. I should mention that those health-based screening levels are developed with children in mind. They're specifically designed to be protective of children. In the case of arsenic, There were, in both Powell Park and Fred Meyer, arsenic was found to be above DEQ's cleanup guidelines, which is not uncommon, as you can see, because the DEQ's cleanup guideline is below the Portland Basin background. So in most cases, in most cases, the measured arsenic was not above background concentrations. But in the case of the daycare in particular, the average concentration was above all of the screening levels that we use. And again, that does not mean that health effects are automatically going to happen or that there's necessarily a risk, but it did trigger us to move on to the next phase of analysis, to do a more in-depth evaluation. So we made some health protective assumptions about children. We assumed a 10-kilogram child, this 22-pound child would swallow about 200 milligrams of soil per day. 200 milligrams is about a fifth the weight of a paperclip. 5 days a week for 5 years while they're at the daycare center. With those kind of exposure assumptions, we found that, and calculating a cancer risk out from that, we found that that the concentrations are still too low to harm the health of children at the daycare center. One thing to note in particular, in the calculations we assumed that all of the samples from the daycare center, that children could be equally exposed to all of the areas where samples were collected. But you'll note that 4 of those samples collected at the daycare center were actually collected, the 4 highest were actually collected outside the fence line of the play area at the daycare center. So in fact, we think that the actual exposure is much less than we calculated for children, because those high samples that are really driving up the average are in an area that's inaccessible to children, at least while they're playing at the daycare center in the fenced play area. Oops. Okay, so for chromium-6, many of the samples were too low to be detected, as Keith was saying. You'll see that because chromium-6 is not measured as often, there's not an estimate of background for the Portland area, so we're not sure how this compares to what one would expect for chromium-6 in soil. Many of the levels do exceed DEQ's cleanup guideline, but none of them exceed the CDC's guideline for health effects. So we did go ahead with a dose calculation and a more in-depth analysis for chromium-6 because one of the health-based screening numbers were exceeded. And again, we found, using those same exposure assumptions about children, that the levels found in the soil were too low to harm the health of children at the daycare center. I should mention that we also did calculations for another scenario where someone would be a 30-year resident living on soil represented by DEQ samples, and in that scenario also, we found the levels to be too low to harm the health of a 30-year resident living in the neighborhood. We think that this should be encouraging news to people. Because of this analysis, we're using the opportunity to change the messaging that's been out there about gardening. Early on in the process, out of an abundance of caution, there was some advice about not gardening within a half-mile radius of bullseye glass. And given these results, we feel that gardening in the vicinity is safe, and that people can safely grow and eat their own produce in their own gardens, especially if they follow the guidelines that we have in our Healthy Gardening fact sheet, and that information is available on our website. I do just want to point out that, as Keith was saying, all urban environments have some heavy metals in the soil, regardless of the area. So there are some common sense precautions that should be taken whenever gardening in an urban environment. And following those guidelines can really reduce the amount of someone's exposure to metals. So we feel that it can safely be done. The two guidelines that two pieces of advice about gardening that I would highlight from our healthy gardening fact sheet is that, you know, it is a good idea to wash hands after working in the soil, and especially to wash the produce before consuming it. So with that, I think we're ready to take questions.
We have Katrina.
Oh, sorry.
I'll-
Yeah,
I'll-
Katrina.
So this one. There we go. Just put that in front of me. So thank you. I'm Dr. Katrina Hedberg, and I'm the State Health Officer with the Public Health Division of the Oregon Health Authority. And as Dr. Saxton mentioned, we do have some specific...
Doctor, could you specify an MD, toxicologist, epidemiologist?
Yes, I'm also, in addition to being the State Health Officer with Public Health Division, I'm an epidemiologist. So I have both MD and Masters of Public Health.
Thank you.
So as Director Saxton had mentioned, we've actually done a couple of things to assess what may have happened with the health status of people who are living in the affected areas. The first thing we did is we do have a statewide cancer registry, and there's a list of reportable cancers that come into the registry for us, and we have looked at that. We specifically examined the cancers that were of concern that are related to exposure to these heavy metals, to cadmium and arsenic, and those are lung and bladder cancers. The results from the analysis that was done in the southeast Portland area did not show any elevation of these two types of cancers above what would be expected. And we're in the process of doing a more in-depth analysis in North Portland related to the Ouroboros glass factory. And again, our analyses that we have done so far have not shown any increase in cancers in that area either. So we were going to have the final analyses. We'll be putting those up on the web by the current ones are up, available now, but we are also going to do a look back further to see not only the cancers, the first one was done in for the past 5 years, but we're going to go back 15 years for all the cancers in these areas, and we expect those to be available by the end of the month, by the 31st. The second piece that we have done is to look at urine cadmium testing. Now, it's a multi-stage process. We have many things that are reportable to public health authorities, and we have promulgated rules to make them reportable to us by laboratories. And we get results not only of positive test results, but of all of the testing that has been performed. And those rules were promulgated as of February 18th. So far, we have cadmium test results on 247 Oregonians statewide. So when we pass rules, it's for the state more broadly. But for Multnomah County, there have been 207 results that have come in Multnomah County residents. Of those, 7, or 3%, had some detectable cadmium in their urine. Now, 2 of those were in children under the age of 18, and 5 were in adults. These results show that, so the process is we get reporting from laboratories, and then we want to be sure to have follow-up, both with the patients to try to determine what their potential exposures were, in addition to where they live, but where they work, hobbies, etc. That's follow-up. And then again, with their clinicians to assure that if there's an elevated level, that there's clinical guidance in how to follow up on those. So we've worked a fair amount both with not only getting the reporting of these test results, but with clinicians in conjunction with Multnomah County, with the clinical community, for them to understand both who's appropriate to be testing and what to do with positive test results. So with that, I think we're available for questions.
And also
I will
just
let-
wanted to mention, it's David Farrer, PhD, not MD, for those of you looking at the card there. So, anyway, open it up to questions.
From what we know about a link between these toxics and cancer, do we know how many years that should take to show up in terms of the science?
Sorry about that. So, cancer is a complicated. Many chronic diseases really are. They're multifactorial. That includes age, family history, a number of things. But with many of these cancers and these exposures, you would expect a lag time, as what we called, of 20 or more years. And again, I know that Dr. Farrer can talk a little bit more about kind of what the level of an environmental exposure would be. But it's not quite as simple as many of the other reportable conditions where for an infectious disease, if you eat a food item that has, for example, a bacteria, you expect to develop an illness within a week and you can trace it directly. It's much more complicated than that when it comes to these chronic conditions, including cancer.
Can you explain to us how it was the Moss study that came up with numbers of arsenic levels 159 times above safety levels? This was a test, and also cadmium levels much higher. So the Moss study found one thing, but your studies found something different, or not? Please do it from the microphone. It's going to be a pain
Yep.
in the butt.
No, I think we'll just stand and maybe take turns.
Yeah,
then.
that's what we did. Sorry.
Thank you for that question. I guess what I would say is that we're sampling very different things. So, and the Moss studies were very sort of new and different and cutting edge. So the idea of the Moss studies were knowing what we know about moss and how they might receive toxins through the air, that could be an indicator of challenges. How they exactly relate to, say, air sampling and soil sampling is simply something we don't know that we fully understand, given the newness of it. So I think this is the kind of information presenting here that will help us make those linkages. In some cases there may be linkages, and in some cases there may not be.
I got a question about the cleanup guidelines for the DEQ. You have level guidelines. I mean, what use are they if all those things that exceed them are not enforced? I know that the acceptable standard that you have is really high by the CDC, but you still have your cleanup guidelines, and all these things are exceeding that. So is it just to kind of know, hey, okay, we're over the line? Or
Yeah, well, that's a good question. Thank you. Really, they're conservative screening levels, so they're set in a way so that if you have values that are below them, and they will vary depending on whether you're talking about trying to protect children or residences or businesses, but they're set very protectively so that if you're not over them, you know that there's really no chance to worry. But if you do exceed them, then I think that's the point where you want to take a little bit of a closer look. And it doesn't, as Dr. Ferris said, it doesn't necessarily mean there's these impacts that have to be dealt with, but it does mean that you do want to take a closer look.
What's the bottom line for people that are we're going to try and explain this to? I mean, is it that the moss showed exposure over time better than the more recent samples, and what you're telling us now is that things are better than they were? What are people living in that area going to need to take away from this?
I'm not sure I'm the sole person that wants to answer that. David, do you want to?
Yeah, I can.
Move my microphone just over.
This one?
Yeah.
Okay, so related to the Moss data, I think the key thing that people, it's been hard for people to understand over the long run throughout this whole process is that concentrations of metals in a moss really tell us nothing about what people are actually exposed to. What the Moss data showed in the beginning was that some metals in moss from some areas of the city were higher than moss in other areas of the city. There's not an established background or normal concentration of metals in moss. So it could be that even areas where moss is higher than other areas of the city are still not related to any kind of exposure that would be harmful. I think that's something that's been hard to communicate and hard for people to understand. So the Moss data alone are not a good indicator of health risk.
And so your new data tells us what?
So the new data from soil, that's something that we do have a good understanding about how people get exposed to soil, and given the soil results that we have, the bottom line is that the concentrations of metals are too low in soil to harm anyone's health living in the community. So
David, there is another round of air tests that haven't come in yet, right? The reason I asked is in October, weren't there air tests that did come back with toxic levels? The October average, and that was what was released in the
Yeah, the levels measured in October were of concern, and that's why we're all here. And the air data is coming out next week, and that'll tell us more about what current exposures are in the air. One thing that I think is also important for people to understand is that when people are exposed to contaminants, it makes a big difference whether that contaminant is inhaled or swallowed. In most cases, toxicity is greater when inhaled than when swallowed. And once a particle of metal lands in soil, it pretty quickly binds to larger particles within that soil, so that the only way someone can really be exposed to those metals is if they swallow that soil. So exposure through soil is much less of a public health concern than exposure through air. And the data that we'll be able to talk about next week will tell us a lot more about what current conditions are like in air.
Is it possible from the air results that we could be getting a totally different scenario than what you're telling us today in regards to the soil? I mean, could there still be reason for concern once we get these air results, or do you expect them to fall in line with the soil results?
Well, we'll be able to tell you when we have the air results on next week.
But is
Well, I guess,
it possible that they could be very different, is what I'm wondering.
I'm not sure I understand the question, but if the air results next week sort of give us pause, we wouldn't expect any sort of immediate change in the soil, if that's what you're asking. The soil really accumulates over time, and it really would accumulate things much more than these emissions. It accumulates car emissions and leaded gas fumes and things like that would land out.
It would take more than a few months for the soil to be significantly impacted from something coming from the air.
Whereas with air, would you expect that if Bullseye's cut out emissions of toxics, that air should be cleaned up quicker than soil would? I mean,
That would definitely be my expectation, right? These metals are parts of particles that will fall out of the air. They're not gases that want to be in the air, so that you would expect them to fall out and ventilate pretty quickly.
Can you talk about the prevailing wind blowing from Bullseye Glass? Because I noticed, there must be reasons for this, but you've checked all on one side of a main road and not on the other, so that's half of it that hasn't been checked. Are you concerned about that at all, or you feel comfortable?
We designed the study to really focus on public areas, and with a particular concern with Cleveland High School, which is sort of between where we went. And so those public areas, those high exposure areas, tended to lie on that side of the facility. We were definitely concerned about other portions. Those other areas around the facility are largely industrial, although I know there are some residences in there. And so we felt like, depending on the results of these testing, that we would then further evaluate whether or not we needed to sort of continue around the circle.
Have you identified any additional sources? Because I know when you released the map, you have several hotspots. There's one, for instance, 52nd and Sandy, I understand. Have you all looked at maybe businesses or other sources that might be emitting these toxins?
Well, DEQ is working on putting together a list of an inventory of potential sources, depending on sort of the contaminant. So that's work in progress right now.
David, could you explain how young children at a daycare playing in a schoolyard with levels of hexavalent chromium and carcinogen above the state's cleanup guidelines is somehow safe?
Yes, definitely. So the screening levels are developed in a way that is very conservative. They assume exposure 7 days a week for an entire lifetime. Children at the daycare center wouldn't be expected. We thought that 5 years was a pretty conservative, kind of high-end estimate of how long anyone would be at the daycare center. So when you consider that 5 years of exposure compared to an 80-year lifespan, that's really what drives the conclusion and also the 5 days a week versus 7 days a week. Those things make a pretty big difference in how the actual risk numbers turn out.
On a different tack, there's been talk and comment and rumors regarding a temporary rule that DEQ might institute in regard to glass manufacturers. So I'm wondering if Ms. Hammond or whoever feels it appropriate could address why a temporary rule is necessary, given that Oregon Administrative Rule 340-246-0110 gives DEQ the authority to implement rules and strategies when the public health is deemed at risk. So why is there going to be a big, long process with apparently limited public input to develop this temporary rule?
Thanks for asking that question. There are two forms of rulemaking that our Environmental Quality Commission has authority to approve. One is a temporary rule and one is a permanent rule. A temporary rule is for those times where we wanted to take more immediate action to ensure, in this case, that cadmium, chromium, and arsenic are controlled at a level that the public is safe. And I think you ask about, is the public involved? A temporary rule is at a maximum of 6 months, assuming the Environmental Quality Commission approves of that rule. During that time, as I said earlier, we'll be addressing and beginning our permanent rules. And our permanent rules, as you likely also know, will have stakeholder participation in all manner. We'll ask that the public participate, and of course our partners in health, because we're looking at a health-based, risk-based permitting program. That will have many times that the public can comment and provide input, and we're going to begin that this month.
Given the
Dan,
Wait a minute.
can we, any
No,
other questions? Hang on,
I
I'll
don't
come back to
feel
you.
the
I'll come
question-
back to you, Dan. Thank
Oh.
you. Any other questions?
I don't feel the question was answered. You have the authority under the OAR rule I cited. Why don't you just invoke that to do what you have to do?
We're working with the company. We sent a letter to the companies yesterday outlining when they could begin to operate. As you also know, the companies have been very good to work with, and they have voluntarily not allowed and not used chromium, arsenic, and cadmium in their processes. We outlined what it would take for them to begin operations. I think all of us know that they are an employer in the area. And of course, the reason we took that action to send the letter and also let them know we're going to do a temporary rule is we want to make sure that the community, that the public's health is protected.
For advocates in these neighborhoods that have said this is a air toxics crises, is it?
I think that we're a science-based organization. We're working with our health partners, and we're looking at areas of concern. And we're going to continue to work with health as we have today and on this area. And we're going to look at the science and the data and then make decisions on that.
Based on the science so far, is it a crisis?
I think that we have some good data today to show that in this area, those results in soils are within levels, I think Dr. Farrer talked about, that are acceptable. We don't have the air results yet. And if we see other things of concern in the air, then we're going to again use the science and the data to make decisions on where and if we should continue to monitor.
Okay, one more question.
The reference to clinical follow-up on cadmium, maybe Katrina could address that. What's happening there, and what concern exists about people who do have clinical levels of cadmium?
So there are thresholds that we look at for what is elevated, sort of above what we consider the 95% confidence interval. All of us are potentially exposed. As was said, these heavy metals are in the environment. And so we look at kind of what the distribution is. And so it's not necessarily that with these, the few cases that are elevated, that there's anything specific that needs to be done, but rather, so any test result, you potentially need to, for example, confirm that that test result was correct and that there's some kind of ongoing. And then you need to look at a variety of exposures that could have potentially led to elevated lead. As was said previously, these are not only in the environment, but people have hobbies where they're exposed potentially to heavy metals, for example. Older adults, many of these heavy metals, cadmium, for example, and arsenic, are in tobacco. So if people are longtime smokers, they might have elevated levels. So again, it's really making sure that that connection is made and that they can talk with their physician about how best to limit either exposure, if they have some of these others, and or what sort of things to monitor over the longer term. So again, those are medical questions. We want to be sure that the people who have elevated are aware of that and that their clinicians are. And as I mentioned previously, and there's a fair amount of information on the web, this website about the guidance to clinicians, both around screening and what to do around if there are elevated results. We have Oregon Poison Control, and the University of Washington has a pediatric toxic group, who are looking at these exposures as well. So making sure that clinicians have those resources of the experts in the area to talk to.
All right, thanks.
Were the levels of cadmium that require follow-up in the children?
So again, we had a total of 7 that were detectable. There were a couple of levels in children that we're going to be following up, both to determine what the potential exposures, the range of exposures, and following up with their clinicians to give some guidance about those.
Thank you. So these folks are available